Hello and welcome back for episode 25 of the Noobie Dentist Podcast. I'm your host, Dr. Omid Azami. I am super excited to be back after a few weeks away from editing and publishing the podcast. I've just been a little bit busy with work and getting back into the rhythm and into the swing of things. I have a lot of great episodes coming up, a lot of great guests, a lot of great content, a lot of great information for you guys, especially for the new grads out there. So take note, and I hope you guys do listen to the series coming up. And definitely, if you haven't, if you're new to the podcast, catch up on the previous episodes as well. In this episode, I'm really excited to have a fantastic dentist, Dr. Keerti. Dr. Keerti is really active on Instagram, and she's become a great mentor and a great friend, and she's always really generous with her time and her expertise and just giving me feedback and helping me out with all my clinical questions that I have. She's really done it all. She's specialized in oral medicine. She's done a Aesthetic Dentistry Continuum at the UCLA, and she's currently a faculty member at the Speak Esthetic Institute as well. She has her own practice. She's really into CEREC dentistry, which we kind of dive into a little bit in this podcast. So I hope you guys do listen to it, and I hope you guys get a lot of great value as I did. She drops a lot of great quotes and a lot of great pearls, and a lot of things that will definitely stick with me and have really shaped the way that I think about comprehensive dentistry going forward. So without further ado, I'll jump into the episode, and I hope you guys enjoy it. Please subscribe on podcast app, on Spotify, on YouTube, and give us a feedback as well. I always do appreciate it. Thank you, and enjoy the episode.
Hello, and welcome to the Noobie Dentist Podcast, the safe place for newbie dentists to connect, collaborate, learn, and grow. The Noobie Dentist Podcast aims to provide high-quality and high-value content for all the newbie dentists out there. With your host, Dr. Omid Azami.
So, Dr. Keerti, how we do this in this podcast is normally we start off with like an origin story. And I know you've had a pretty cool history just, based on what we talked about before. So if you want to, maybe give us like a, brief, like 3 or 4 minute version of like from high school onwards, what you've been up to. And then we'll sort of pick and choose from there, and we'll kind of take things from there.
Yeah. So that was a while back, high school. So after I grew up in India, and after high school, in India, we decide on a profession after high school. So if you have applied for dental schools or medical schools, you go right after.
Yeah.
So you're pretty young when you get into dental school or medical school. So that's what I did then.
And how long is that? Because I know like
that's a 4-year program plus 1 year internship. So yeah.
Wow, it's pretty short still. Because I know like in Iran and stuff, we have like my cousins are doing med school there, and it's like 7 years. Like so, it's like from high school they go into like med or dent, but it's like 7 years. So it's
right.
So full on. But
so high school. So to us, so I don't know the system, but it's K through 12. So after the 12th grade, you find yourself, with cadavers and doing dissections, and it's a bit of a shock for an 18-year-old for sure. But that's the system there, and then the 1 year internship is mandatory as well. So that's kind of, I would say, 5 years. So so I did that, and I got married early on, moved to the States, and decided to continue to pursue dentistry. That's when I applied to different programs, advanced training DDS programs, some master's programs. Actually, I was really interested in prosthodontics and oral medicine. Okay, so nice. I applied to various schools, got into for advanced training at UCLA and some other schools, got into masters in pros, actually. Got matched to SUNY, Buffalo and Indiana. And then got into oral medicine program at University of Washington and at Harvard, and I decided to stay at UW.
You didn't go to Harvard?
I did not go to Harvard.
Is that like a cool like little like cheat so you can not do your DDS but you can be a specialist, right? So if you
exactly,
that's pretty cool.
I decided to stay at University of Washington because I got into a fellowship here already. I was doing a fellowship in the dental care of the disabled, which was a really unique program.
Yeah.
And I wanted to definitely do that. So that was a year-long fellowship. So I was already doing that, so I decided to stay here in Washington State. Went on to do my master's in oral medicine.
Not Harvard this time, or
what's that?
Not Harvard again, or somewhere else?
No, stayed right here. And I just loved it. I practiced oral medicine and pain, TMJ, after school. I think started in '99, and did that for a while, and then started doing general dentistry on the side.
Okay.
And then got more and more into general dentistry, less and less into oral medicine. And I think this is kind of my advice for the younger dentists, is that follow your heart. That's what I wanted to do then. I did that, and I was really interested in oral. I still love it. I absolutely love oral medicine still. First love of my life over aesthetics even. So just follow your passion for that. People always ask me, did you have a vision? Did you have a vision?
Yeah, that's a big question I was asking.
I don't believe in that, Omid, actually. I think I believe in values over vision, because vision can change. It should change, in fact, every 5 years. You should have a different vision. Otherwise, you'll be stagnant, won't grow. Values should be core values, solid values that they should not change. And one of the values that I have been blessed to have is that I love to learn.
Yeah.
And I just love to stay on my feet, stay nimble, learn new things. And so I think that's kind of what people ask me, like, did you have a vision where you wanted to end up? And no, I still don't know what I want to be when I grow up. So
that's the best. So let's go back to the oral medicine days, because that's pretty cool. And I was talking to, so on Instagram, I posted people to ask some questions if they had any. And Stephanie Tran, Her Holiness the Pulp, kind of reached out to me. We did an episode a couple of weeks back. I still haven't published it. So she actually told me that you did oral medicine, which is pretty cool. So let's just talk about oral medicine for a couple of minutes, if you don't mind. I know it's an area that a lot of, I myself personally, I feel like I don't know anything about it, truthfully. I look at it, I'm like, this looks funny. I'm like, it's the first thing I'll refer out is oral medicine, because I don't even want to I don't want to deal with it. Because the consequences can be pretty dire, I think. So and it's pretty cool. I have a cool oral med story. I was in my fourth year of dental school. We started off with a rural rotation. And so it was my first 10 weeks of my final year of dental school. We went to a small town outside of Melbourne, 2 hours out. And it was a Friday afternoon, and some guy called the office that we're working in, and he said, I think I bit my tongue and I don't want to see a female dentist. Is there anyone that can see me? So everyone's rolling their eyes oh, this is nothing. So he comes in, and I'm seeing him because my partner was a female and he didn't want to see her. So so I look at his tongue and I was textbook SDC. I'm oh my God, this is bad. And it was massive mass. It was growing around his one lone standing bottom molar. And that was pretty cool. That was one of those moments where dentistry can be serious, but at the end of the day, a tooth is a tooth and it's not that big of a deal. But this stuff is life and death, right? So when I saw that was an interesting thing. So we right away called the main hospital in the city and arranged a referral, and he went over and did a biopsy, and it was confirmed. And he had to have major surgery, he did hemiglossectomy, all that stuff. So that was pretty cool. That was my kind of one expertise, or not my one exposure to oral medicine.
Yeah, good for you. You know what, Omid, people actually think that that's oral medicine. I think it's to me the best thing that I got out of my program was a way to think logically, think step by step. I think it's everywhere. You are practicing oral medicine every day. If you are practicing comprehensive dentistry, you are practicing oral medicine. Patient walks in, you're checking their airways, and you're doing a head and neck exam. It's everywhere. When you're doing diagnosis, you are practicing oral medicine, right? I mean, you're not cutting right into the tooth. Well, I have a story. I used to teach for a while at the U, and there was we had started this program at the University of Washington where I think second year students were rotating through the clinics. And this was years ago. So this kid, he comes in and says, "Well, I think the tooth is infected." And I said, "Well, why do you think that?" He said, "Because the patient said he has pain." So there was like a senior, and then the second year working with him. The patient said he had pain. So I don't know what got into me. I pinched him really hard, and he goes, "Oh, why did you do that?" I said, "Did it hurt?" And he says, "Yes." I said, "But is it infected?" So he goes, "No, I think that was his first oral medicine lesson, that just because it's painful doesn't mean it's infected." I think I left him with a good bruise, and but I think he learned his lesson. But yeah, I think oral medicine is everywhere. In the smallest of things, you know, how you look at things when you know to start looking at the bigger picture. I think you're
so for the new grad who's, you know, like in their first like 6 months of working, what's like, as an oral medicine, with your oral medicine hat on, I know you have many hats, what's like the 5 things that they don't know that they should know?
Head and neck exam. Do it with intent. I think doing it with intent is the key. I see when I was teaching students, they would breeze through it. And if you do it with intent, there's going to be 1,000 times you're not going to find anything. And there's going to be that one time that you do, like you were describing the case before, it's going to be well worth your time. So I think, and that applies to everything. Doing it with intent, good head and neck exam. Airway, second. It's, if you want to practice good dentistry, good comprehensive dentistry, look at the airway.
So how do we do that in terms of like clinically with, like, is it through imaging or like clinically we're looking at it?
Clinically, look at the back of the throat, you know? So it's just that easy. Third is look at the bigger picture. You know, to me, when so now I don't take referrals for oral medicine unless there's a friend. Every year I get 3 or 4 referrals that I will take in only because I enjoy it and to help a friend out. But I don't usually take referrals for it. But like I said, we are practicing oral medicine every day because if a patient walks in and if you have decided that the goal for you is to be doing comprehensive care, then when the patient walks in, you are doing a good head and neck exam, looking at the airway, and then looking at the bigger picture. Patient walks in with that number 15 crown that keeps popping off, or number 8 fractured incisal edge, and you just try to fix that, and you're not putting your oral medicine, oral diagnostician's hat, then you're not looking at the airway. You're missing, is their pathway where? Is this person, is number 15 the first point of contact? What changed? What is changing in this person's physiology that this is beginning to happen? So I think that's the key point. So I think those are the
main points there.
3 big ones. I don't know about 5, but I think for
putting on the spot here.
For a general dentist, I think for a general, if you can do that, I think you're doing.
No, I think the intent point is a really good one, because even myself, like, I'm pretty impatient with it. I think because I think we're like, we're a dentist, let me just jump to the teeth and let me do my thing. And if you kind of just quickly whiz through, and like I just love like within normal limits or whatever. It's like fill it out. Like, it looks pretty normal, I think. So I think that's cool. I think I'll take that. And I need to start. I know for sure that I need to start. Like, I mean, I have a look. It's not like I don't do it, but I don't think it's intent filled. So for sure.
I think a lot of again, you know, sort of marrying the two. the two things I love so much, oral medicine and comprehensive care, interdisciplinary dentistry, I guess, aesthetics people like to call it. To me, it's interdisciplinary care. A lot of your audience, I think a lot of the younger dentists really want to, because that's a shiny, the shiny veneers, right? A lot of the younger dentists want to do that. There's nothing wrong with that at all. But if you want to do that, you want to set yourself up for success. So all of the paths to success go through comprehensive care. If you want to do that, you know, that 8 veneer case, and you are, when a patient walks in with that chipped 8 or 9, and you're only looking at that, that case is walking out the door. You don't even know it, because you need to take a step back, do comprehensive care. So that was one of the things I did when I started my practices. I decided that we were not going to do any limited care. So all of our new patient exams are 2 hours long.
Wow, nice.
Even if a patient calls in pain, I will try to accommodate them within the next couple of days. But since 2010, I believe, we have not taken a single new patient into the practice that did not commit to a 2-hour exam, including, radiographs and
so can
pictures.
If you don't mind, like talk us through like sort of the overview of what you do in those 2 hours? Because I think that'd be pretty valuable for most people. Because I know like most offices that I work at, like obviously we have hygienists, they'll bring the patient in, they'll do like the, full mouth series or bite wings or whatever it may be. And then I'll just come in, I'm literally in there, I don't think like 15 minutes, and I'll just look around without intent. I'll do my extra oral, intraoral, and then I'll do my charting and then diagnosis. And then that's pretty much it. And then we just have a chat with the patient about what they want to do. But that's something that I think I've been lazy with it because I know the proper ways to be more comprehensive about it. So I'm interested to see how you, like, if you spend 2 hours, which seems like a good amount of time, I'm sure you get like thorough everything. So what's like your sort of protocol?
And it's, but it's not 2 hours. It's not the whole time is with me, obviously, but no, going back to your point about, and that's how I was, and I did my preceptorship, the UCLA Aesthetic Continuum. If you did the whole program, you got a postgraduate certificate or whatnot. And I did that years ago. And I remember sitting through those lectures and going, there is no way I'm going to be doing the 12, the 16 aesthetic shots. There's no way. Yeah. I don't know who does that. I don't even believe anybody does that. Frank Spear does that. Probably Jimmy Eubanks does that, and Jeff Morley does that. And those are the 3 people that do it, and I will never do it. And I sat there and I remember thinking that, and I do that now. So
that's great.
So so I think it's the barriers that we put in our mind. And I used to think the same way. There's no way I can convince a patient come and spend 2 hours with me. And by the way, you're not getting a cleaning in those 2 hours. So I thought that, I think those were the barriers that I had kind of set in my own mind for myself. Even though I had all these amazing mentors telling me how they practice. In the 2 hours, we start out with a pretty detailed consult with the patient, to evaluate their goals, what they want to do, what their vision is for themselves, for their values. Exactly. Actually, that's why I was chuckling when I said that, because don't you know that? When you start talking to the patient, I'm sure you've experienced that their vision for their teeth actually is based very much rooted into their values, right? Because they will be like, well, I don't think I need this, or my parents never had their teeth till they were, into their 70s, they had dentures. And that's the value system they have for their teeth, and then their vision is also limited, right? So we talk about that. Then from then on, we take a panoramic radiograph. We take bite wings and PAs as needed. Then we take the whole series, the aesthetic shots. So,
and are you doing this, or not the radiograph part, but the clinical pictures? Are you taking those, or is your assistant or hygiene?
My assistant's very well trained in that now, so she does that. And so they're doing that. The hygienist comes in and does the period charting. And the hygienist also does the Velscope exam. So she does her brief head and neck exam, and then when I come in, I do the head and neck exam. And then, years ago, I was lucky enough where I started my practice late. So I, to your point earlier, everyone's in a hurry to start their practice. But I was lucky enough where I did it quite late in my career. So I was an associate for a long time. I'd been through the oral medicine thing, done that for a while, been through some, obviously a lot of Spear courses, taken as one course, the UCLA thing I was interested in. So by the time, I'd done the UCLA program already. So by the time I started my practice, I decided that I was going to have my own form sort of the comprehensive care exam sheet. Anyone who wants it, I have it, by the way. And it's sort of like an amalgamation of everything.
That's pretty cool.
From courses here in UCLA, yeah. And so we do that exam. It starts out with a head and neck exam, the TMJ, muscles. It doesn't take that long, actually. It sounds like a lot. And then airway exam. We check occlusion, we check function. So after the exam, I seat the patient up and have a consult with the patient and go over some larger points. And then usually we bring them in again for another consult if it's a larger treatment plan.
Yeah. And how, in terms of, like, I know myself and a lot of other new grads, we kind of get stuck in maybe not having the confidence to like present like big treatment plans. And we kind of stick to like, okay, you need this in like a few cavities here, a few cavities there. But we don't have like the confidence to be like, okay, you need like 8 crowns, you need like 9 crowns, even though clinically like they'll need it. Like, we're not trying to like push treatment or anything. It's just, we don't think like, we can't necessarily afford maybe as new grads to like pay like 12, 13 grand ourselves. So we're not, like, there's no way this guy can afford it kind of thing. So I think we hold ourselves back from like asking.
I so agree with that.
So when, like, obviously like, you have a lot of training, so I don't want to like dumb it down for like people who are just coming out of school and we've done nothing yet. But when did you have that breakthrough that you're like, I'm confident that this is what needs to be done. This is the proper way. This is what I would do like on my mom or my sister or my wife or whatever it may be. And this is what I'm going to present. And this is it, like, take it or leave it kind of thing.
Yeah. So I think that, the biggest shift happened in my head was after SPEAR, the SPEAR first program is the FGTP workshop, the facially generated treatment planning workshop. Interestingly, the first time I attended that, again, even though I'd been through the UCLA program, I sat there and I said, well, nobody's doing that. You can't be doing that. And I took it again. And that's the workshop I mentor now,
nice. Okay.
which is very interesting. One of my favorite things to do in dentistry, absolutely, hands down at this point, is interdisciplinary dentistry, because it brings together all of that knowledge, all of that experience that one gains very painfully puts together over the last so many years, right? So I think that's where the shift happened. And I'll tell you, it wasn't so much about doing; it was more about seeing. I had a pathology instructor years ago who would always say, when we would look at slides, that your eyes do not see what your mind doesn't know.
That's good.
And you can translate to anything in life, be it relationships with your employees or the slides or your treatment plan. So the shift happened after maybe doing that FGTP workshop, maybe the third time. No one said I was a quick learner. So I think that's when I realized that, oh boy, there's a lot more to see here that I'm not seeing. And then once you start seeing that, then it becomes a part of your core value that then you don't have a problem. It just rolls right out of your tongue. Do not worry about saying, oh, how should I tell the patient 4 crowns, or or sometimes, how do I tell the patient, this kid, you are not someone I want to treat in my practice. That's why God made prosthodontists, and that's where you're going. So there are times when you have to take a step back and say that. You look at the whole picture and you go, oh my God, I can fix that number 14 for you, but you are resistant to any more treatment, and you don't understand that you are a case that you need to be fully under the care of a prosthodontist. And you have to be able to say that and be able to explain that to the patient as to why you're doing that or why you're saying that. So I think once you start seeing, then if you're not able to see it yourself, you can't show it to your patient. So once you start seeing it yourself, and it's, again, comes back to learning to see, then you can start saying that. And that's when all the barriers sort of lifted. And
so that's all education. So you have to really be out there taking CE and learning and always expanding what you see, right? To even know.
Good. Yeah. Good CEs, get good mentors.
Yeah.
I know you've had this, you're doing an amazing job, by
Thank
the way,
you.
with this podcast. I think all of the dental students should be listening to this, but I think that's the theme that it's a recurring theme, isn't it? With all
for sure. Mentorship's big.
All of it. Yeah. Find mentors that will save you a ton of money and save you a lot of time, because instead of you stumbling from one place to the other, find a system. Gosh, this Instagram thing is so amazing. You can look at,
cool.
Right? It's amazing, because I didn't even know much about it, and I just recently got into it, and so look around and see whose work you like, whose philosophy you like, and get yourself a team of mentors.
Yeah, for sure.
It's free, right?
It's worldwide now. It's worldwide, which is cool.
Yeah, get yourself coupled in Perio, get yourself 5 or 6 Bros mentors.
Yeah.
You just sit there and you do that, and it's amazing. And then just ask them, what course should I take? And I there are people that reach out to me via Instagram, and I tell them, like, could be something as simple as what loops you got
several.
Or what courses to do, but find yourself a good mentor, and I think that's the key. I think there are a couple more things that I really believe in. So one is the structured learning. It could be Spear, Kois, Pankey, Dawson, doesn't matter. Find one and stick to that, because that's how we were raised. We dentists, we are pretty driven people. K through 12, we had a structure and we knew how to excel in it. And then we went to dental school and we knew what the curriculum was, what the coursework was, and we were doing awesome and we were doing great. We knew what the problem was that we needed to solve. And then you put us out in the world. We have no structure and we're confused, right? We're confused and we don't know what to do. So find yourself a structure and stick to it. And second is set some goals for yourself. Because I think that was the one thing that I felt really lost after getting out in the world was I felt lost. I had no goals anymore. And first year dental school, your goal is to get to second year with good grades, and then second to third, and third to fourth, and the graduate, and you think that's going to be it, and then you almost hit this sinkhole. You feel like there's nothing more to do. What should I do next?
That's so true.
So I think that be involved in different organizations. I think for younger dentists, AGD is amazing, because you can set yourself a goal for fellowship. Easy to attain. So that gives you some structure on the side. As you're pursuing your, dental career on the side, you have a goal to attain. I think that anchors me.
I think I'm the same way.
It anchors a lot. Do another fellowship. AACD is amazing. Set that goal for yourself. Make it doesn't matter. Make it a 10-year goal, but do that on the side so you have a sense of achievement, because to me, that's how we raise our kids in this society, to accomplish goals, and then all of a sudden we take it away from them, and then we go, now go fly free.
And that's perfect. And I think that leads me perfectly into what I was hoping to speak with you next. Because what you said is perfect, because I had the same experience when I graduated. You have all these ambitions, right? You come out of school and you're the whole world's your oyster. You can do whatever you want. You got this cool degree. You can make decent money, and but it's also very easy to do nothing. You just find a job and you come home and just watch Netflix all day and then you go to bed, and it's a repetitive cycle, right? So I think I got in that trap. My first few months, I had all these goals. I'm I'm going to start all these I'm really entrepreneurial, so I was all these business ideas, and I want to have this podcast, this and that. And then for 6 months, I was just figuring out dentistry. I was at work and I'm stressed out about how to do a filling and having open contacts and stuff. And then you kind of just come home and you're tired and do nothing, right? And I started taking some CE, and I think I've kind of slowed down a little bit. So I was a little bit upset about myself regarding that, because I feel from like maybe 3 months to like 9 months like of practicing my first year, I got comfortable. Like I kind of stopped challenging myself at work and like stopped taking on like harder procedures because maybe early on I was like really bullish and I was like doing like crazy things that and then you screw up sometimes, right? And you kind of have to pump the brakes.
Yeah.
And then I think I reverted too much and I was like, I'm too comfortable. Like, let me just relax. Let me just do my fillings, do some crowns here and there, do some endo here and there. But I wasn't at work like nervous about the next procedure, which is like not good, I don't think, especially early days. You gotta go to work and you gotta be like shaking. Like I think like not that you're unprepared, but like you haven't done it necessarily. Like you gotta push yourself, right? So I think the structure is amazing that you recommended. I think having some structured courses.
But you are a little different. I think you're being a little too harsh on yourself because you are an innovator. So what you're doing, I think there are a lot of younger dentists looking at you going, I wish I could do a podcast like, Omid over there. But so you're already blazing some new trails and it's helping a lot of people. Yeah. So I think, so that's really innovative, really cool. So you created your own little structure for yourself. I mean, you're making yourself sit down right now and talk to this older dentist, right? So, so I think you created your own structure for yourself. Not everyone has the luxury or the ability to do that. People are not very comfortable doing some of the things that you're doing.
Thank you.
So I think, but even they can create little attainable goals for themselves. I think that's important for us.
I think another mistake that I made it's funny because I talk to a lot of dental students now and I hit them with like a hard no because I get messages from like students at like University of Toronto here and like, oh, how much money are you making? Like, what's your production? Like, I'm like, man, like that's not, because I was the same way. Like I would have been probably asking the same questions like to new grads. And that was like a good lesson because when I got out, I was working and I was like, all right, I need to make like X amount of dollars today. And then I'd be like genuinely depressed if I didn't like make that much money. And then like, so like my whole mood like swung not on like my clinical performance or like how good my work was, but like how much money I was making. So after like probably like 5-6 months, I was like, I need to like change this because it's not healthy. And like, it's not like money shouldn't be like the end all be all of this. Right. So I think for the past 6 months, I started like rubber damming everything. And like you said, mentors, like I met some good mentors that I've been podcasting and getting inspired from like the guests on the show. So I made my appointments longer. I wasn't like trying to like maximize everything. Like I'm just take my time and like do things properly. And I even made more money like as a like byproduct. But I think that's my biggest advice is like, that you should have goals, but I don't think money should be the goal. Like at least for the first like 2-3 years, anyways. Like clinical for
not
sure.
Not at all. Yeah, I so agree with that. I think follow your heart. It's easy to say now, but those worries will never go away. Yeah. A few years ago, in our state, one of the big insurance providers cut the reimbursement rate severely, and a lot of practices suffered a lot. So I think if that's the angle that you always have, let me assure you that worry doesn't ever go away, because your needs expand. Before you know it, you have 3 ops, and then you have 5 operatories, and you have 7 staff of 7, and so on and so forth. And an insurance provider drops or leaves your area or cuts down reimbursement. So I don't think that's a good way to look at it. I think the way to look at it is to keep yourself future ready, stay nimble, and stay humble. So stay nimble because don't get comfortable, learn new things. A few years ago, I am not a computer savvy person at all. And a few years ago, I got into CEREC, and there isn't a single day that I'm not working with that CEREC machine now. I think 99% of the stuff I do on my CEREC. I'll do most of my implant stuff on CEREC. I just love CEREC. But also stay humble, because just when I started getting comfortable with CEREC, I realized that, I'm not doing veneers with CEREC. I still send those out. I am not doing full mouth cases with CEREC. So that is the part of staying humble. So now that's my next goal, is to get better at that. But the point of bringing this up is that you can't just focus on money. You have to focus on yourself and how to continue to improve your skills so that you're future ready. So you don't know how the shift is going to happen in this world and in the area that you practice. But you should have different kinds of skills that keep you marketable. But if you, again, it comes back to values versus vision. That should be the value. If you're just only thinking short-term money, you don't even know how much money you're going to make once you focus on good dentistry.
That's for sure. And how's so CEREC is an interesting one because obviously we had it at some offices and it wasn't always like the associates were kind of just doing like restorative work and we weren't getting like because there's an older established office, one of my offices that I work at, and we didn't have like we had like a massive patient base, but not a lot of patients, new patients coming in. So most of the patients were obviously like existing patients and seeing the older principal dentists. And so I wouldn't do many crowns and stuff there, but we had the CEREC there and I was always like bummed out that I wasn't like taking the opportunity to like use it and like learn from it. So what do you recommend in terms of like what was like the learning curve for CEREC? Like did you do like CERECdoctors.com and like just do the courses on there or?
Yeah, again, through Spear, because CERECdoctors.com, Samir is basically in Scottsdale with Spear. So I took some courses there. Now the learning curve is still, it all boils down to you. I mean, it starts out with you just looking at that machine, like peeping from behind the curtain, looking at the machine in the corner, going, "What what did I just do? Why did I buy that?" Then progressively, you walk up to it and touch it and run back to your office and sit down. So that's where it started. Trust me. And then again, the same thing. It's the recurring theme of our lives of us dentists. I think some of us are more like me, and some others are more, I guess, braver, bolder than I am. But same story again. I would think that, oh gosh, I got this machine now. Because I loved it. I saw some really good work. So I bought it. I really don't know why I bought it. It was not a financially motivated decision at all.
You just need new toys at work, right?
Exactly. It was something that just attracted me. And I thought, oh man, I want to do this thing. I really want to do this thing. It started off with me being really afraid of the machine. and then, saying, let me try it. And then I remember my first few CERECs I did. I had booked the patient for 4 hours.
You don't want the time pressure.
for 4 hours for like, I think number 14 crown or something. I used to still I never believed this was going to work out. So I used to take preliminary impressions, to get my assistant to get ready for temps because I would be like, this is not going to work out. We'll have to put the patient in a temp. So, and then we used to take impressions on every patient. I used to send it to the lab still, have them pour a dye, bring the dye back, send the patient in a temp and send them home. I did that, I think, for good first 10 crowns, believe it or not.
Nice.
And would take the unit that I'd milled, put it on the dye.
That's so thorough.
Check it
That's the
under
best.
the microscope.
That's great. Yeah. Wow. Microscope.
So check it under the microscope because all of these years I had trimmed my own dyes and I would get the dye back from the lab and trim it under the microscope, send it back to the lab, and then the lab, my ceramist would bring the case back and I would put it under the microscope and check his margins. And I said, well, if I'm doing that to him, I should be holding myself to the same standard. So I did that for the first time.
How does the CEREC measure up in general? It's pretty good.
It was awful in the beginning. Awful. And that's when I was feeling really bad. I was like, no, this is milled. This is milled versus pressed. I mean, this is just never going to work out. I mean, the guy's pressing, I'm milling him. This is not going to work out. So this margin, nope, it gets better. Yeah. Trust me. Again, it gets better because it's not because the CEREC machine got better. It's not because the OmniCam got better. It's not even because my scanning skills got better, because, they were good when I started doing it, and they got slightly better. But actually, what changed was me focusing on my hand skills all over again. This was well into my career. Yeah. So that's, like I said, stay humble.
That's great.
Just when you think you're going to hold your ceramist under the microscope, you got to hold yourself under that microscope too. So hand skills improved, and I think getting more focused, refining those margins, taking that extra time, and it's interesting because what you put on the front end, you get at the back end.
Yeah.
And now our CEREC start to finish is like 2 hours, maybe 2.5 hours appointments, slam dunk fits, you know. So yeah, it's a
That's pretty cool. So you don't take impressions and stuff anymore either. You're pretty confident with it now.
No, I know. Not anymore.
So do you do mostly like indirect restorations versus direct, or is those still pretty balanced?
Pretty balanced. Yeah. So yeah.
Okay, that's cool.
It's a mix of patients I have. So
awesome. So I'll end off. I think it was a great conversation. So thank you, first of all, before we kind of jump into some quick rapid fire fun questions. I think there's a lot of good stuff in there for the listeners, and I think there's a lot of good value in there and vision. But this is like a new thing. I haven't done it with any other guests before.
Oh, nice. Thank you. Thanks for making me the first one.
I'm going to ask you like random questions and maybe like 3 to 5 answers, whatever you come up with. And then I'll just maybe we'll do 3 of those and then we'll call it a day. Okay. So what's your top 5 favorite teeth to work on?
Top 5 favorite teeth? Number 29.
We need a Canadian universal conversion kit here as well.
Gosh, I love them all. I mean, an anterior case, 6 through 11. That's a good one. I like that question. Yeah.
And
I'll tell you what I don't want to work on is 32.
Okay.
116, 17, 32, and the 12-year molars. I don't want to work on them. So if I get an associate, I'll get an associate just to work on those teeth.
That's great. And so what's your like, if you can only have 3 burrs, what would you choose?
Oh my God. All 3 of them are going to be winter burrs. You know, the winter burrs, Rassler's winter burrs. So I think the 6 millimeter, I think I'll do 6 millimeter 1.2 burr. I'll do a 6 millimeter 1.0. Can I have 4, please? Because I'll have medium grits in both of those and fine grits in both of those. Yeah.
All right. And the last one is, what kind of music do you like? Do you listen to different music? Do you put your own music, or you get the patient to like choose the music in the office? Or is this radio?
No. I pick my own music.
So what's your what's your playlist that you have?
Ben Howard. Yeah. It's Ben Howard radio. Yeah. Ben Howard's the guy with we have one of those, I don't know what you call them, stations.
Yes. Ben Howard.
And I forget the name, but Pandora or something like that. And we have the Ben Howard radio. Okay. So,
and the last one is, if it's one procedure you could do for the rest of your career, what would it be?
That's a good one. I think it has to be a CEREC online.
CEREC online?
On number 14.
Why not? My best one that I ever heard, and I wish I remembered who said this so I can give them credit. And they were like, I wish I could just specialize in premolars. I was like,
oh, nice.
Specialize in premolar dentistry. That's like, that's awesome.
But I really like number 14 because it has some substance, you know. So when you're seating, that's what I was thinking. When you seat, it's like you hold the premolars. Just those when you're seating is especially because when I was doing traditional work, you have a die, so you can put your little restoration on the die and then polish it. I don't have a die now, so I want some substance to hold on to. So number 14. I like
Thanks
that.
a lot for being on the podcast. It's been a great episode, and hopefully we'll catch up at some other point. We'll do another one. And good luck with everything on Instagram. Keep up the great work on there with the carpule art. I think it kind of died off a little bit, but hopefully we'll revive.
I stopped. It was getting out of control, so I stopped for a little bit.
You took it to the beach. Like I was like, man, that's like commitment.
It's getting serious.
I need to step my game up. I'm just like, that's great. Awesome stuff.
All right. Well, thank you so much, Amit.
Yeah.
It was great talking to you. Thank you. Bye.
Bye.